sometimes I try to do things and it just doesn't work out the way I want it to. And I get real frustrated. And like, I try hard to do it and I like take my time, but it just doesn't work out the way I want it to. It's like I concentrate on real hard, but it just doesn't work out. And everything I do and everything I try, it never...
So this is going to be a quick video, just giving you an update on what happened when I went to see the psychiatrist today. And basically, the last visit I had, I did not see the psychiatrist. I saw the nurse, and I think it kind of freaked her out because basically I went in there and I told her that I just didn't care about anything right now, and I had stopped taking my medication. And basically, she spent the rest of the visit just trying to get me to take one of my medications so I could start sleeping again. And then when we went out, she told the receptionist that I needed to be there within a month and I had to see the doctor. So that's what this visit was. And basically I told him everything that's been happening. I told him about the depression that started in October, and that I was feeling hopeless and suicidal at that time, and that I basically went off on medications. That at the end of December, I started to come out of that depression, and I started to see signs of mania. But then there was the whole situation with my wife that happened at the beginning of January that put me in a major suicidal depression that, a couple weeks later, I've eventually worked my way out of. And after that, I started having, I guess you could say, severe signs of mania, spending money, restlessness, a big appetite, racing thoughts, hallucinations. And then that's what was going on with me right now. And basically, he says that when I got into that major depression, that I should have gone to the hospital. He says that he was, that he was kind of disappointed that I didn't call him or do something. He just said that he would have made sure I got into the hospital because he just says I should have went to the hospital, which would make this the second or third time that I should have been technically, I guess, hospitalized, and I somehow avoided it. And basically what he's going to do to treat me right now is he's going to increase my Seroquel, hence the shirt in the title of this video, got Seroquel. I had already been increasing it when I first went back on it. I started about 150 milligrams for a week. Then I went back on 200 milligrams for a week. Then I went on 300 milligrams on a week. And I was taking 450 right now. And I was going to do 600 on Monday. And he says, no, he wants me to do 600 tonight, which I've already taken it. So I should be getting sleepy soon, or I don't know. I haven't been getting sleepy when I've been taking it. And then he says, take that for 3 days. On Monday, he wants me to go to 800, and then I'm going to be seeing him in 2 weeks, or not him, but seeing somebody in 2 weeks, and we're going to see if we're going to increase it. And he says we might increase it eventually up to at least 1,200, or at most, I think he said 1,200, because he says basically we needed to stop the mania and stop the cycling that might be happening. So I don't know. My wife was happy with this. I guess that's the aggressive treatment she was looking for. I'm just worried about taking the Seroquel because it does make me really, really groggy, and I do gain weight on it. I might start using the new Vigil again, which my wife doesn't want me to use because of the teeth clenching thing that happens with me. But we'll see. Because I do need to function, and yeah. And then the other thing that happened, which is I guess is kind of good, is I'm going to start seeing a therapist on Monday. I haven't seen a therapist the whole time I've been diagnosed with bipolar. So I don't know. I guess I'm kind of excited about that because, like I said in another video, I've learned that talking really does help, and I guess I'm excited about that. And again, if you guys have any tips about seeing a therapist for the first time, or any stories from your first time seeing a therapist, let me know in the comments. And thank you. Peace. Love and peace.
It's like I need time to figure these things out. There's always someone there going, hey Mike, we've been noticing you've been having a lot of problems lately, you know? You should maybe get away and like, maybe you should talk about it. You'll feel a lot better. And I go, no, it's okay, you know? I'll figure it out. Just leave me alone. I'll figure it out, you know? I'm just working on myself. They go, well, you know, if you want to talk about it, I'll be here, you know? And you'll probably feel a lot better if you talk about it. So why don't you talk about it? I go, no, I don't want to. I'm okay. I'll figure it out myself. If they just keep bugging me, they just keep bugging me. There's pills on the side. It's got me. It's too hard to come. I'm afraid what's one side. You won't have anything. I'm afraid what gets you seen away. I'm not crazy. Here's the design. You're the one that's crazy. Here's the design. You're driving me crazy. Here's the design. They stick me in an institution. That what's the only solution to give me the professor to take me from the enemy myself. I was in my room, and I was just like staring at the wall, thinking about everything. But then again, I was thinking about nothing. And then my mom came in, and I didn't even know she was there. She called my name, and I didn't hear her, and then she started screaming.